Hi, everybody. Welcome to Beyond Telehealth and Telemedicine is Medicine. So we have 5 minutes with the Fink. I'm Dr. Lisa Finkelstein, and I'm happy to introduce my good friend, Dr. Ken Sbat. We went to medical school together way back when in Philly. So hi, Ken.
Hi there, Lise. How are you, honey?
Good.
Hi, girl.
So introduce yourself and tell us all your credentials, what specialty you practice, and where you practice.
Okay, my name is Dr. Ken Sbat, and as Lisa said, I trained at the Philadelphia College of Osteopathic Medicine, and I did a fellowship in pulmonary critical care and also practiced sleep medicine, as well as being board certified in internal medicine. And currently I'm practicing generally internal medicine, and I still do pulmonary and sleep as well. I'm just outside of Philadelphia in Pottstown, Pennsylvania, and I just recently started a new venture where I opened up my own practice, a small concierge medical practice in Pottstown, where I have myself, a nurse, and a front desk person. Prior to that, I was part of a management team employing over 300 people, and we had 65 providers. So it's nice to take it down to a small scale. And I'm glad to be here tonight to talk to you.
All right. Well, so this is great. So we have two different practice models. And let's talk about in your previous practice model, this big group, to now very patient-centered model. Were you using any telemedicine previously? And how about now?
Prior to the pandemic, we were not using telemedicine. And just up till a month ago, I was also working for two practices, my own practice, and I was still helping out my older practice. So I was practicing pulmonary there, doing sleep medicine, then doing primary care. We started using telemedicine. It was in the second week of March. And it looked like a ghost town in our office. We have a very large office in the pulmonary division. And without having patients there, it was a big difference, a big challenge too.
Yeah. So now you have this other care model, and you have a cell phone and an app, and you're using telemedicine. How is that working out for you? And what platform are you using? What EHR are you using?
Yeah, well, right now we're using Athena as far as our EHR. Initially, we were using UpDocs. And I'm looking to change that. I was also using my cell phone and doing a lot of FaceTime. Many of the patients didn't have the capability of just following the instructions to log in into the software. So yeah, we adjusted. We used telephone, we used a cell phone, and we used a computer. We used it all.
So what are some of your biggest challenges using telemedicine, and what are the positives?
Yeah, the biggest challenge is actually getting some of our older patients who are not computer literate to actually get linked in to the software. And that is the biggest challenge. When that happens, you usually have to go straight just to telephone, because they get very frustrated once you send them the link to come on, whether they come on via a text message or an email. But the majority of the people, I would say about 65% of our patients were able to handle telemedicine in the appropriate fashion. We were able to do telemedicine with just FaceTime with some of our patients with using a cell phone. Some of the older patients who easily adapted to FaceTime, their kids showed them how to use it. So the benefits of all this was, as you know, the fear that was involved with coronavirus prevented a lot of these patients from even thinking of stepping outside their front door, never mind going to a doctor's office. And this enabled us to take care of those people and do it in a very regimented fashion where we made it very easy on them. As an osteopath, we do a lot of hands-on.
Right.
So, and we were taught back in school, the biggest thing is the H&P, doing a very thorough history and then physical exam. And I think the history is more important in many aspects than the physical exam. So we used our skills, and it really enabled us to take care of people the way we wanted to, and did well for them.
One of the things that that we talked about before was you started using a form of what we call remote patient monitoring, and you were saying that you ask your patients to buy a blood pressure cuff, a pulse ox, and a thermometer. Give me an idea of how that works and how that aids you in your telemedicine visit.
Well, part of the physical exam, getting something objective. So especially with the pandemic, the biggest question was, do I have COVID? You don't really know that until you actually get them tested. So we make sure that they have all the supplies, and I instructed them. I would, one at a time, every patient I had, I said, this may be a long-term thing. We don't know when this virus is going away. So what I want you to do is, if you can, I want you to get one of the blood pressure cuffs, go to CVS and just get one. It does it automatic for you. Get a thermometer where you don't even have to put it in your mouth. You can just put it on your forehead. And we had them get a pulse ox. A lot of my patients are pulmonary patients because they transitioned over from my pulmonary practice to my primary care practice. So we had the devices necessary to at least create an objective foundation, in addition to obtaining history and just their appearance, whether they were in distress, right, or did they have a rash, or, is there anything else that they have? And I asked them, is there anything that I can look at that may, whatever the problem may be, and they cooperate.
So you got eyes on the patient with telemedicine, and you are headed into the next phase, which is doing this remote patient monitoring. So perfect. You're on the road, and I think that's awesome. So we are at 5:07. Now hold on before we finish with the last question, because there is, all right, that was just a quick comment. So leave us with a funny telemedicine story.
Well, the funniest one I had, and this happened towards the beginning of telemedicine when we were using just FaceTime. I had a patient who had traveled from the Philadelphia area down to the Washington, D.C. area. And upon arrival to his destination, he told me that he had a problem with the backside, his buttocks. And he says, it really hurts. It feels hot. And his wife was with him, and she goes, it doesn't look good. So I said to him, well, I got to take a look at it. And he actually took down his pants. His wife was helping him. And he showed it to me, and it was hard for me to determine the size of the lesion. And it looked like he had an abscess from a boil of some kind. And his wife says, wait a minute, I have an idea. And she came back. She had a silver dollar and stuck it right on his buttocks and says, it's this size. And I took a look, and I cracked up. I couldn't stop laughing. And she said, what? I said, no, that was very creative of you. But it helped us, and we were able to get him to an urgent care center to get it lanced and taken care of. But and
that's another beauty of telemedicine, is that patients are at home or, in their comfortable environment, and they feel comfortable, if you're okay with it, to have an exam like that. And, they didn't have to come in and see you. Right. And that's fantastic. So that's a good story.
I think this is just going to keep going too. I think this is a big part of medicine. This is going to be the future of medicine, I really believe. For a lot of patients.
Yeah. All right. Well, I'm a believer too, for sure. Go telemedicine.
There you go.
All right, Ken. Well, thank you. That was fantastic. And hopefully I'll see you soon, maybe next year.
Okay. Say hello to Mark for me.
Okay.
All right.
See ya.
See you guys. Take care. Bye-bye.